Do you wonder if you're the best version of yourself? This is the question we seek to answer in this podcast. We reveal information that helps you recover your health and become resilient. Modern life makes us fragile. Our diet, lifestyle, and environment set us up for failure. We do not accept this. We seek optimization. We strive to become dynamic. Hey, what's going on? Dr. Chris here. Today I'm going to be talking about dizziness. Dizziness and vertigo. These words are kind of used interchangeably. For some people it has one meaning, for others it has a different meaning. So the first thing I do with patients that complain of dizziness is clarify what type of dizziness they're having, because that gives me a lot of insight into what their symptoms are and what the proper diagnosis is and how we're going to proceed to treat it. So dizziness for some people can be lightheadedness. It could be room spinning dizziness. It could be just being nauseated. It could be feeling off balance or feeling shaky. It could be this sensation that I hear a lot, feeling off kilter or feeling kind of woozy. And that's the type that I want to talk about today. But for starters, if you're experiencing dizziness, please share this podcast with somebody. You can also go to my website under I believe it's the services tab. There's a vertigo section, and there is a differential diagnosis chart you can download for free. So it has a list of symptoms and a list of diagnoses, so you can kind of get a feel for what may be going on. The room spinning dizziness, they'll kind of last a minute or two when you turn your head. That is most of the time is BPPV, which is the crystals in the inner ear problem. Stands for benign paroxysmal positional vertigo. I've never experienced it, but I've treated it a ton of times. Apparently terrifying. A lot of people end up in the ER, end up on drugs for it, and physical therapy can treat that usually about 15 minutes. Usually takes 1 or 2 sessions. That's it. And actually, let me just pause there and tell a quick story, because I just think this is kind of horrifying. So my first rotation in school, I was following my clinical instructor around, and I was in the ER. That was the setting. So we had to do all different types of settings when we're learning. And the therapist, so first of all, to be trained in treating dizziness is a vestibular certificate or vestibular background. So not every therapist knows all the ins and outs of this. So if you do need some help with this, look for a vestibular therapist or someone who's trained in treating vertigo. Anyway, my therapist I was following did have a really good background in vestibular therapy, and she was going to check in on a patient, and this patient was about to have a surgery to remove her vestibular cochlear nerve, or sever it, and leave her with a Bell's palsy on one side of her face because she was having severe room-spinning vertigo. Therapist that I was following luckily knew how to treat it, and she fixed it in 15 minutes. This blew my mind that the physicians in this hospital were not aware of this condition, how easy and non-invasive it is to treat. So I just want to tell that story because it's just shocking how over-surgerized we are in this country. But let's get back on track. So room spinning dizziness is usually that problem. If it's not that, it could be something called Meniere's disease. Then there is lightheadedness. Oftentimes it's a blood pressure issue. If you go too low, you tend to get lightheaded. So there's orthostatic hypotension. If you stand up quickly and your blood pressure drops, that'll cause you to feel lightheaded or faint. Also, just being hypoglycemic can also make you feel that way as well. So a good idea, if you're feeling that, to maybe get a glucose monitor and check out your blood sugars. But the topic I want to talk about today is called VOR hypofunction. It's very common. I see it very often. It usually happens along with one of these things that we're talking about, along with Meniere's disease, or especially with BPPV, and especially in those who have been dealing with that for years. I've seen countless people that have been dealing with that crystals problem for decades, not knowing that there's something so easy they can do about it. And what tends to happen is they don't turn their head very much. They don't like to look up or down or to the sides, because it can provoke this really horrible dizziness or vertigo. So basically the reflex that I'm about to talk about sort of gets, I kind of think of it as like atrophying like a muscle does. It's more miscalibration is really what it is. So VOR is the Vestibular Ocular Reflex. So your ability to look at something and turn your head and keep your gaze fixed on whatever you're looking at, that is that reflex at work. So picture you're in a car and you're looking out the window and you're looking at a tree and the car goes around a curve, you're able to fixate on the tree because of this reflex. Now the way it works is a little bit complicated, but you have these semicircular canals in your inner ear. And this has nothing to do with hearing, by the way, although there are some conditions that can affect hearing and provoke dizziness, but the inner ear is not like the outer ear, so this is different from hearing. So in the inner ear, we have these 3 semicircular canals on both sides, which helps us figure out where we are in space. So inside these semicircular canals are these hair cells, and there's fluid inside these canals. There's actually a bilayer of fluids, so 2 different layers with a different gradient. So one's more sodium based, one's more potassium based, which is another thing that can trigger dizziness, by the way, is electrolyte imbalance. Anyway, when you turn your head in one direction, the fluid on one side pushes the hair cells in a certain direction, which triggers the vestibular nerve and goes to the opposite side of the brain, to the vestibular nuclei, and then the opposite thing happens on the other side. So it's kind of this push-pull mechanism. Then your brain takes that information and helps you decide where you are in space. And because there's a left side and right side, it's kind of like having 2 engines. One can get miscalibrated. So picture a boat with 2 engines. One's 150 horsepower. The other's 50 horsepower. I mean, that boat's going to probably be difficult to steer straight. You're probably going to veer to one side, which tends to be one of the symptoms. You may notice if you have this that you're tending to veer to one side. And there's actually this really fun test that I use in the clinic. It's not the most sensitive test in the world. It's called the Fucada step test. It's really simple. It's really fun at parties, by the way, especially if alcohol's in the mix, because everyone will test positive. So basically all you have to do is close your eyes and march in place for 100 steps, and then open your eyes and see where you are in the room. I mean, most people will track forward a little bit, but some people will just spiral out of control. It's hilarious. Anyways, that's a sign of a miscalibration of that reflex. And the good news is it's pretty easy to fix. There's these gaze stabilization exercises we use to recalibrate the reflex. So think of you're looking at an object. We usually draw the letter B on a little sticky note, put it on the wall. You kind of shake your head back and forth, up and down, like you're saying yes, like you're saying no, while fixating on the object. And you do that and you speed up the rate at which you turn your head. And there's a whole, like a 2 to 3 month progression that we take you through. It's definitely a very benign situation. No medicine needed, no surgery needed. Exercise can correct this. So there's a couple different ways that we diagnose it. Probably not a bad idea to see a GP or ENT first, just to rule out any kind of nasty pathology. But what we look for is something called a saccade. So a saccade is your focus, your eyes will kind of quickly jump from one object to the next. I think the word saccade is French for jerk, like the eye is jerking. Now, you may have heard of nystagmus, so this is different. Nystagmus is a very rapid twitching of the eyes in one direction. So to use the same analogy of riding in the car, so now say you're riding in the car and you're looking at your friend who's looking out the window and watching trees go by, and they're not looking at one tree, just kind of, their eyes are kind of twitching back and forth really rapidly. That's what nystagmus looks like. So saccades are different. So a saccade is basically what I do to kind of diagnose this quickly. Is I have someone look at a colorful tip of a marker, for example, or any object, and you have them trace the object with their eyes, keeping their head still. And you'll see when this is positive, maybe they can track the object going to the left nice and smoothly. And when you bring the object to their right visual field, you'll see kind of a jump in their vision. So yeah, there's other tests for it too, but that's kind of my quick screening tool. If you were to test positive for this, I definitely would want to look at your balance as well, because balance, there's a lot of things to balance, like just general strength, for example. But when it comes to the sort of central component, the neural component of balance, there's 3 inputs that predict how you're going to do with balance. One is your proprioception, so that's your ability to sense joints. So if you can close your eyes and then bend your elbow and straighten your elbow, your brain knows that's what it's doing, because there's joint receptors in the joint, in the elbow and all the joints, that tell you that I'm bending the elbow. So that's proprioception, so it's huge in the feet. Then you've got your vision, and then you've got this inner ear function, right? So if you take one of those things away, say like an older person who gets macular degeneration, they're only left with two components of these three pillars to maintain their balance. That's why there's a lot of falls to the elderly. That, and for many other reasons too, like joint replacement. Because if you have a fake knee or fake hip, you're getting less proprioceptive feedback from that joint. Anyway, you can isolate the system pretty easily. So isolate the vestibular mechanism is what I mean, the inner ear function. So if you have someone stand on something compliant, like a piece of foam, you're getting faulty feedback, right? So you're not getting a strong sense of proprioception. And then you have someone close their eyes, and you watch how much they sway. That tells you, you're basically isolating the only thing working in that system, which is the vestibular mechanism, the inner ear function. And by the way, one little off-topic thing there. So all these shoes, these big cushy soles, everyone thinks they're doing themselves a favor with these nice cushion shoes, especially runners. Well, you need the feedback from the ground, especially when you run, so you don't fall, right? So there's been some studies that there's actually more impact than cushion shoes because you're trying to find the earth, you're trying to find the ground, and if you have this big cushion you're standing on, it's hard to feel it. So just a little side note there. So anyway, that's basically what a vestibular evaluation would look like. I would want to check for everything and go through that little symptom checker list that I have and test you for things like BPPV, and if it's negative, I'm going to look at saccades to see if that's positive, look at balance, and then address accordingly. And by the way, I have built a DIY dizziness program for this specifically. So this program I built is a 3-month program. It's all digital. You can just follow along the exercises at home. I will put a link for that in the show notes, but I would prefer if you contact me first so I can determine if you have that, because I can usually figure out over the phone if this is what's going on, or at least get a good idea and maybe have you come in for one session and then we can do the program remotely. Anyway, what causes all this in the first place? So I kind of mentioned that it usually arises secondary to something like BPPV, but there's a whole laundry list of things that cause it. So just let me pull up my list here. So about 51% of the times, it's idiopathic, which is just a technical term meaning we don't know. We don't know why, 51% of the time, why it happens. There's also roughly between about 15 to 20% or so can be due to toxic or metabolic issues, such as the use of antibiotics, aspirin, alcohol, vitamin B12 deficiency, folate deficiency, hypothyroidism, NSAIDs can do this too, and penicillin. Then about 4 to 12% of the time, it could be some sort of infection like a Borrelia infection, herpes simplex, for example. And then roughly 10% of the time, it could be from something autoimmune, like Sjogren's syndrome or colitis, celiac disease, another big one. These can all cause it. And there's some other things too. There's some genetic stuff, some vascular things as well. But those are the most common ones. So if you get some dizziness, don't freak out. Definitely get checked out first. Rule out all the bad possible stuff. Most of the times, it's nothing horrible. And a vestibular trained physical therapist can help you. So I'll post some links in the show notes for the symptom checklist, and I'll also post the course that I created for VOR Hypofunction. And as always, if you have any questions, feel free to reach out. Thanks. A ship in harbor is safe, but that's not what ships are meant to do. What does this mean? It means exposing yourself to difficult situations so you become resilient. If you need help building resilience, check out our flagship program called Physiologic Flexibility. This is a 3-month do-it-yourself program that teaches you how to maximize your homeostatic regulators, such as your pH, blood glucose, O2 and CO2 tolerance, and temperature. We give you specific action items through the program with the goal of becoming anti-fragile. If you want to become the inspiration for your friends and family, this is the program for you.